The most important point about the classification of the device as medical device is the intended use. What this device should be used for which kind of target population, how the user would interact with the device, what the device tells in a way to the user, to the clinicians in this case. The decision support system will be a system that will be classified as a medical device, probably class 2. It is subject to the medical device regulation because in a way it is based on driven methods and models. It will be important to comply with this regulation too. There is an important aspect for this kind of application that would be in any case important for a medical device in itself. That is the fact that the user must be aware of what the system is capable of. He must be put in a position where he can decide or she can decide to trust or not the system because it is a support system. Human oversight is important in a high-risk AI application in general, even more for a certified medical device. And imagine if we are talking about spinal surgery. It's a very delicate topic. There are a number of requirements from the technical point of view we have to comply with. In terms of how we are internally managing the process of developing, designing, developing and certifying later in the future the device, the first aspect is about implementing the quality management system. In short, this means that every aspect from the description of the data that we use for the design, training and testing and validation of the data-driven models to all the single versions and the outcome of all models that we develop in the project. It's about tracking down all the possible aspects that can affect the safety, the accuracy and the quality of the outcomes. Quality management system is important, and a subset of the quality of the requirements for the quality management system is about the quality of the data itself. For the hybrid and the data-driven, it's extremely important, the quality of the data in the input of the process. That is part of the aspect that I have to personally manage, how to ensure that the data is verified, that all possible issues related with the data imputation, outliers, possible conditions that we identify, and biases that we find in the data. We must identify them, be in contact with the responsible persons that are collecting or processing the data, and verify that we address properly the issue. And this becomes part of the technical dossier that ultimately will lead to the device to be certified. Another extremely important aspect is to very clearly identify the requirements in terms of liability. We have clinicians that will need to use the device that wants to be reassured on if I trust the system, what does it mean? That who is taking the decision? How do I decide that, or who decides that if my decision is really my decision or was affected significantly by the output of the system? And then also how to provide additional contextual information that helps the user to understand the output, understand if they can trust the output. Those are all requirements that we have to deal with within METASTRA. The Act will be applied. The most concerning requirement is about human oversight. Where do we stop as humans and where do machines start as automatic systems? And where we do define the responsibility between these two parties. That's something that we will have to cope with. If I can prove that a certain output was the result of a number of steps and I have the possibility to explain and clearly verify the chain between the input and the output, then even when you have not that much data, millions of people that you tested the device with, you can prove your point also to regulatory agencies. If, like I always have, not always, but most of the time happen in healthcare research, in clinical research, you have a number of subjects that the sample is relatively limited. You have hundreds of people, thousands of people in the best case. A data-driven model that has been validated on a relatively small sample in terms of data-driven methods is critical when the method itself is not explainable, because then the burden of the proof is on the data. Then I would need to prove that my sample characteristics are really representative of my target. In METASTRA, part of the methods are fully data-driven. This aspect is very important. The fact that we have to come up with a final design of the device that allows the user to be in control of the process. We have to add as much as contextual information as possible to allow the user to properly use the device.